do you know when a teen needs a program like day treatment? And are there signs to look for?
So there's often four things that I would ask a parent to look for when making a recommendation for this level of care. So the first thing we're going to look at is mood changes. Is there an increase in sadness, irritability, maybe anxious related anxiety or worries? So that would be one thing that we would want to look for that's kind of out of the norm for your teen. Another would be changes in behavior. So if there's an increase in isolation, maybe more time spent in room than there has been in the past, or less interactions with the family system or socially. Maybe you had a teen who was highly involved in extracurricular activities and they've now dropped out of those, or there's reluctance to engage in other activities. Another one would be physical changes. So increased like agitation or restlessness, or the opposite, right? A teen moving really slowly throughout the day. So maybe like climbing the stairs at a much slower pace than they typically have in the past, day after day. That could be a sign to look for. And then finally, if there's avoidance of situations. And oftentimes at this level of care, we see many of those concerns coupled together. So it's not just one of those, but several different kind of signs that they might benefit from some extra services.
Right. And do school grades tend to slip too, or are they not going to school? Is that part of it?
Yeah, so during the school year, we would also look at maybe academic performance or engagement. So avoidance of school could definitely be a sign that a client could benefit from deep treatment. That could be due to like depressed mood and low motivation, or anxiety and avoidance of a situation. Or also like a decline in academic performance. Perhaps you had a student who was getting B's and C's and now they're getting D's or failing, having a hard time organizing things, turning in papers, etc. Could be a sign to seek out counseling as well.